We're going to be using a lot of equipment out there. In this video presentation, we're looking at the diagnostic equipment called an EKG. But on the EKG or this machine, there's quite a lot of other things that we can use to monitor our patients. This includes the EKG with the cables that will register the electrical conduction and a waveform that's represented on these screens to tell us how many times that heart has electrical activity over it. Now, it's important that you feel for a pulse, and that when we hear changes to the machine, and we see these lines start to change, then is that actually happening, or is that some kind of artifact movement? So we want to check to feel the pulse every time we hear changes on our machine. So again, it can check the heart tracing, or the EKG. It can also detect our SpO2, or pulse oximetry. This is a cable and probe that attaches from the machine over the patient's finger. Now the probe device may be something more of like a clothespin device or something that we tape on them. So look over the equipment and know which pulse oximetry device we're using. Other cables that may come off of this, besides the EKG cable and the pulse oximetry, may be the NIBP. This is a non-invasive blood pressure machine. It's more likely that your manual blood pressure will be more spot on or more correct than the machine at sometimes. Because as you practice, you'll become more and more confident, more and more sure, and more accurate with taking your blood pressure. The machine, depending on its technology, has to acquire this blood pressure, and there's a lot of movement and a lot of tubes, and sometimes there's movement of the patient as well, and so this may cause the numbers to be slightly off. So what we use this machine for is just to track trends, and in the case where we're limited in hands, where we don't have an extra person in the back of the ambulance with us, this machine, we hope, will be recording to its best of its ability. Now, to ensure that this records, we try to make sure that the patient holds still, at least the arm, when it's taking the blood pressure. Keep the arm straight, try not to move. And when we're doing so, we're trying to make sure that the cords are all free, and that when we see the blood pressures being taken, we're trending them. That means that the first blood pressure to the second to the third to the fourth, these numbers are pretty much similar or spot on. If we see that there's a dramatic change, for example, if a blood pressure was a 120 over 80, and now it's 220 over 120, we may need to double check that manually. And we probably will if the patient's condition hasn't changed. If the patient seems to be the same and the machine just erroneously took some blood pressure, we're not going to trust the machine to just take it again. Let's go down there and be prudent and do a manual blood pressure check. Besides the manual blood pressure or non-invasive EKG, pulse oximetry, we also can attach additional leads to do a 12-lead EKG. This would be placing 6 additional stickers along the anterior portion of the thorax or chest, and then acquiring this. We'll also have additional devices to acquire what's called an Untitled CO2 Monitor. This allows us to read the amount of CO2 that the person is breathing out. So it gives us an idea of, is the person adequately ventilating and exchanging air? If their end-tidal number is very low, it could be a result that they're not able to get that air in and out. The waveform also helps us to determine what's going on. Now, get yourself familiarized with the different diagnostic equipment. We're showing you 2 different pictures in this video slide. On the left-hand side, we have a LifePak 12. This is a Physio control monitor. It has everything. You can see the cables that are sticking out from it, but it's not all connected up. In fact, there's no carrying case on it, and the printer system is slightly different. So we'll go over this and the face of the machine in class a little more, but it's up to you to practice using these devices. Familiarize yourself with the screen and the buttons. To the right hand side of our screen, we're showing you a Zoll monitor. It's just the face and the oscilloscope. This is where it shows us the lead tracing. You can see that it shows defib ready at 200. It's saying that a shock is advised. And if you can see, it says pads. So the lead configuration is just addressing this pads that they put on the patient's chest. The operator's blue thumb finger right there is showing that he's got a glove finger on what looks like to be the shock button. So apparently he might have charged this. At 200 joules, it's ready, and he's going to depress the shock. We haven't gotten that far yet, but let's familiarize ourselves with the two pieces of equipment. The LifePak is used with AMR, American Medical Response currently, and the Hawaii County Fire Department is going to be transferring or changing over to that machine. Currently, they're using the Zoll, which is depicted on the right-hand screen with the operator using the blue thumb. So we need to be versatile between knowing how to use both pieces of equipment. Familiarize yourselves with the equipment and keep practicing. Learn how to put on the EKG, 3 lead, 4 lead, and 12 lead. Learn how to check the equipment, change the leads, move from shocks to pacing to normal. Find out how to record or print out the EKG strips. In the meantime, always use your skill sheets when doing skills.